Welcome to another episode of Wednesday Wellness Debrief. I'm your host, Brittany, and today we're diving deep into a topic that's fundamental to understanding our well-being, yet often overlooked in individualistic approaches to health: social determinants of health. You know, we often talk about healthy eating, exercise, mindfulness, and all that is incredibly important. If you've been following me on the podcast, my business, you know how integral that is. But what if I told you that where you live, how much money you make, the education you receive, and even the color of your skin can have a profound impact on your health, sometimes even more than your personal choices? That's what social determinants of health are all about. And for me personally, this topic couldn't be more relevant right now. Disclaimer: our aim with this episode is to offer a supportive space for learning and discussions about wellness. However, it's vital to understand that the information shared is not a substitute for professional medical consultation. We encourage you to use what you learn here as a starting point for conversations with your own medical provider, who can officially diagnose and develop a treatment plan tailored specifically for you. As I'm planning my final year of my master's degree, hallelujah, my thesis semester is right around the corner. And one of the main foundational points for my research is the social determinants of health. I first really learned about social determinants of health in graduate school during my racial justice class from an incredible guest speaker from the National Institute of Health. That experience truly opened my eyes to the systematic factors that shape our health, and I've been captivated by it ever since. So what exactly are social determinants of health, or SDoH as they're often abbreviated? Simply put, they are non-medical factors that influence health outcomes. They are the conditions and the places where people live, learn, work, and play that affect a wide range of health, functioning, and quality of life outcomes and risks. Think of them as the foundational building blocks of our health. I found some resources from the American Health Information Management Association, the Social Determinants of Health: Improving Capture and Use by Applying Data Governance Strategies. The World Health Organization created the Commission on Social Determinants of Health in 2005. I know, so long ago. Hospitals and healthcare systems are increasingly recognizing the vital role of SDoH. So, for example, in April 2024, the Data for Better Health states the Center for Medicare and Medicaid and the Office of the National Coordinator for Health Information Technology are two of the agencies that SDoH data is regulated, especially for technology developers and provider organizations related to the implementation of certified health information technology. And I know you're just like, Brittany, what does that mean? I linked an example article from Health Exec, basically stating a number of major health technology companies such as Oracle, Cerner, Epic, you know, those big major EHRs in hospitals, and many more partnered with the White House in 2022. And they started evaluating and piloting the integration of specific screening tools in the electronic medical record for SDoH. So you may not realize it when you go to the doctor or the hospital, but facilities with these major EHR systems are collecting the SDoH data to put it into your medical record. This isn't just about curiosity. This data helps healthcare teams gain a more holistic view of patients' life beyond just the medical symptoms. If a doctor knows a patient is experiencing housing instability or food insecurity, it completely changes how they might approach a treatment plan. It allows for more personalized, effective care that addresses the root causes of health challenges, not just the symptoms. I say this is a huge step forward in truly treating the whole person. So we're going to start breaking down each of the categories for social determinants of health. Let's start with economic stability. This is huge. Poverty and income inequality are directly linked to poor health outcomes. When people struggle to afford nutritious food, safe housing, or even transportation to medical appointments, their health suffers. It's hard to prioritize organic kale when you're worried about keeping the lights on. Next, education, access, and quality. The level of education an individual achieves often correlates directly with their health status. Now, you may be asking, why is that? Because education can link to better job opportunities, higher income, and greater health literacy. It empowers individuals to make informed decisions about their health and advocate for themselves. Now, this one might seem obvious, but it's worth emphasizing. Healthcare access and quality. This isn't just about having insurance, your job giving you insurance, or you just getting insurance. It's about having access to doctors, dentists, mental health services, pharmacies conveniently located in your community. It's about the quality of care you receive, including care that is culturally competent and respectful of your background. Next, think about where you live. What does your neighborhood look like? This category includes things like the safety of your neighborhood, access to green spaces, exposure to pollution, and the availability of healthy food options. If you live in a food desert with no fresh produce readily available or next to a polluting factory, your health is at risk. Finally, and so crucially, we have social and community context. This encompasses the relationship we have, the support networks available to us, and the level of discrimination and injustice we experience. Social isolation, discrimination, and lack of social support can have a profound negative impact on both mental and physical health. Now you might be thinking, wow, Brittany, this is a lot. What can I as an individual do about these massive systematic issues? And honestly, that is a fair question. While individual actions cannot solve all the problems, understanding SDoH is incredibly empowering. First, we have to shift our perspective. It helps us to move away from victim blaming. When someone is struggling with their health, instead of just thinking, why don't they just eat better? We can start to ask, what are the systematic factors in their life that are making it hard for them to access healthy food? This fosters empathy and understanding. Second, it empowers us to advocate. When we understand the roots of health disparities, we can advocate for policies and programs that address these underlying issues. This could be advocating for affordable housing, better public transportation, investment in quality education or policies that reduce discrimination. Remember, your voice matters. And frankly, this is a big part of what I hope my research can contribute to, providing evidence to support meaningful change. Third, it helps us practice compassionate self-care and care for others. If you're facing challenges related to SDoH, be gentle with yourself. Recognize that you are navigating complex systems, and for those of us in positions of relative privilege, it's an invitation to extend compassion and support to those facing greater barriers. Finally, it informs our personal wellness journey. While we can't control all of the SDoH impacting us, understanding them can help us be strategic about the choices we can make. I invite you to think about these 5 categories of social determinants of health: economic stability, education access and quality, healthcare access and quality, neighborhood and built environment, and social and community context. Remember, this isn't about guilt or blame. It's about awareness and empowerment. When we understand the full picture of health, we can work towards a more equitable and healthier world for everyone. I want to thank you for joining me today on Wednesday Wellness Debrief. I hope this episode has shed some light on powerful influences of social determinants of health and inspired you to think more broadly about well-being. And if you're interested, I'll definitely be sharing updates on my thesis journey and how these concepts continue to unfold in my research. I've also linked all of the articles I've mentioned in this podcast episode in the description if you want to do more research. Remember, true wellness is a collective effort. Make sure you subscribe, leave 5 stars, leave a review. And until then, stay well, stay amazing, keep nurturing your amazing self. I'll see you guys next week.